I'm Dan Desmond of the California Health Medical Reserve Corps. We're a federally authorized medical reserve corps and also a 501c3 nonprofit. We serve as an umbrella to support other medical reserve corps in public health to not only respond to disasters and emergencies, but to foster preparedness and to build more resilient communities.
Our mission has always been to serve vulnerable populations here in LA County. We now have about 2.5 million members. 1 out of every 4 people who live in LA County are our members. The mission actually has not changed since the pandemic. The mission has been more complicated since the pandemic in terms of getting people access to vaccinations, access to care. Well, we believe in partnerships across all areas of healthcare. You can't, as a health plan, do it by yourself.
The most important was to find partners that could actually help us achieve those goals. We partnered with various faith-based organizations and with social clubs, and we also partnered with CHMRC, which was an opportunity for us that was very, very helpful for this problem specifically. Because CHMRC was able to bring forward resources to engage the communities with outreach.
It's very challenging for families who are low income to navigate through the many organizations, both private and public, that they need to obtain all of the resources that are out there. So this often results in visiting several different locations to receive services. And we thought it would be absolutely fabulous instead to bring the services to the clients in locations that are both easily accessible and where residents feel comfortable visiting.
Microsoft was able, with Microsoft Vaccine Management, to adapt to our need to be able to do on-the-fly pop-ups, be it at a farmer's market or a community event, all the way out to the farm workers in the field, tribal nations, or even now as we are today with a stand-up location every day at a fairground and a mall with people being scheduled to move forward. That was critical for us. So once again, working with MCS and Microsoft, we identified a need for a call center.
We've used technology to reach out to hundreds of thousands of our members by robocalls to try to let them know what's going on, and also by live calls to find out if they're okay, find out how they're feeling about the pandemic, how they're feeling about their own health. I don't think you can be successful as a modern healthcare plan without relying on data and relying on technology in as many different forms you can find it.
So CHMRC doesn't hire people to build things, it hires people who have built things so that they can then combine the things that they've built to be more effective. It has developed partnerships with all kinds of entities that you might not think are willing to work together. The pharmaceutical companies, IT companies, and then they're able to blend solutions that benefit everybody. And that approach, I think, is extremely powerful.
With Microsoft, what we're able to do was to provide them that data in a timely manner, be able to provide local situation awareness for the healthcare systems and public health so they could course correct their messaging and their campaigns moving forward, but also finding with this to protect the privacy of the data, because they realized that this was the opportunity for technology to really support a common need of the community. It's not technology first, it's technology supporting and empowering individuals and organizations to truly address COVID proactively and build trust going forward.
The partnerships that we formed solved current problems, but they also were going to help us in the future.